Hello and welcome to Psychology Demystified. Today I'll be covering something that a lot of people use and misuse when they're talking about themselves or someone who they know who is obsessed with cleanliness. The disorder I'll be talking about today, or demystifying, is obsessive compulsive disorder, or OCD. Now, a lot of people say that when they're clean freaks or they love things a certain way, organized a certain way, and are very particular about lists, that they're OCD. The reason why I chose to demystify OCD is so that people can realize that OCD is something that some people deal with, that is often trivialized when someone quickly asserts themselves as having it when they don't actually have it. So today, I'm demystifying OCD. OCD, or obsessive compulsive disorder, is a common mental health condition where someone has obsessive thoughts and compulsive behaviors. OCD can affect men, women, and even children. If someone starts exhibiting symptoms of OCD early, it's not usually when they're very young, it's usually during puberty. And then a lot of times it becomes more obvious as someone goes into early adulthood. The difference between being a clean freak or someone who is obsessed with organization and someone who has OCD is that being a clean freak allows you to function and organize your life. However, when someone has OCD, it can be distressing and cause significant interference with someone's life. And that's where the difference comes in. Now, some people are wondering, what on earth causes OCD? Where does it come from? It's not exactly clear where OCD comes from, otherwise we'd have figured out how to handle it. However, there are a couple of factors that do contribute to someone's OCD. To start with is family history. You're more likely to develop OCD if a family member has it. And so usually it has a genetic component to it. Sometimes it also happens because of differences in the brain. Some people with OCD have unusually high activity in some areas of the brain, or they have low levels of serotonin in their brains. Life events could also be a factor. OCD may be more common in people who have been bullied or have experienced abuse or neglected. And it sometimes starts as after an important life event, such as a childbirth or even a bereavement. Then you realize that someone then suddenly has OCD. Personality, how someone is wired. Someone who's very neat and meticulous and methodical is more likely to develop OCD. Doesn't mean that they will, but they're more likely to, because it's for them, it was an easy transition into being obsessive and compulsive about it. Doesn't mean that you will. Keep in mind, just because you are neat, methodical, meticulous, and because you have high standards, it doesn't mean you will. However, you are more likely to if you were so inclined. So how does someone know if they have OCD? Although the most common thing that we know about OCD is someone loves things that are clean and organized a certain way, there are different types of OCD. However, they do have some things in common. OCD of various types has three main elements in common, and those are obsessions, emotions, and compulsions. Obsessions are where someone has an unwanted, intrusive, and often distressing thought, image, or urge that repeatedly enters their mind. So it repeatedly enters your mind and causes anxiety, and it also causes disgust, self-disgust, and also unease. Let me clarify what obsessive thoughts are. Almost every one of us has unpleasant or unwanted thoughts at some point, but that does not mean that we have obsessive thoughts. An emotion is where the obsession itself causes a feeling of intense anxiety or distress. And finally, compulsions are repetitive behaviors or mental acts that a person with OCD feels driven to perform as a result of the anxiety and the distress that is caused by the obsession. So all of them seem to be one domino effect of another. Compulsive behavior temporarily relieves the anxiety, but the obsession and anxiety soon return, causing the cycle to begin again. For example, someone who's obsessed about, who has obsessive thoughts about being burgled or being robbed may repeatedly and compulsively check the doors and windows all the time. And that means that they can barely go to sleep because that's all they are doing. Not that they check 4 or 5 times like you would normally do because you're going to bed and you want to make sure everything's fine. This is repeated, excessive. It's stopping them from functioning. It's stopping them from sleeping. It's stopping them from doing what they need to do. It's causing them anxiety. That's the difference between simply checking the doors to make sure they're locked and having OCD about being burgled. All of us at one point have thought twice or more about locking the door, thought about something harming us, thought about a violent or an offensive mental image. However, if you have OCD, what happens is that this is persistent. It never stops. It's unpleasant. It clouds your judgment. It starts to affect your thinking, and it starts to affect the way you react to life. Now, it's possible for someone who doesn't have OCD to have obsessive thoughts or compulsions, but most people with OCD have both. Some common obsessions that may affect people with OCD are the following. Fear of harming themselves by mistake. For example, fear of setting the house on fire by leaving the cooker on. Some of us double check, but then someone with OCD multiple checks in a manner that actually makes them not eventually leave the house. They also have a fear of deliberately harming themselves or others. Sometimes they have a fear of harming their own children, and that would probably start for a woman during pregnancy and then after a child is born. And that's an obsessive fear and a thought. And that's where we'll stop today because I don't want to make the video too long. But next week, look out for more on OCD so that you know exactly what it is and you know how to help someone who has OCD, or you know how to help yourself if you have OCD. Until then, hugs and kindness always. Take care and be kind because you don't know what someone's going through. Bye!